Well, thank you very much, Anthony, and thanks to those of you that have joined us live today, and then those that will be listening online a little bit later. It's great to have this opportunity. I never like to rub in that 300 days of sunshine too much because I'm sure our melanoma rates are probably higher than in the UK. And just so I didn't have too much sunshine in my life, I didn't actually marry a Scottish lass, Catriona MacPhail, who keeps me kind of in that blend of the UK and the United States. We actually have close family members in Sitka, so we get over to see you guys now and again, as well as at BSAVA. But I did want to point out the email address, mlappin@colostate.edu. Please don't hesitate, especially about this webinar, to follow up, just in case my American English sometimes makes something unclear. I certainly want to make sure all of our key points are understood. So please follow up, and I do usually respond within 1 week. And to be perfectly honest, though, several hundred come per day. And so if for some reason you don't hear back within a week, please write back and in the subject line say second attempt, which always catches my eye because then I know that I actually had missed someone, and we'll never want to do that. So it is interesting to be an internist and talking a little bit about canine and feline dermatology. Very fortunate to have Jennifer Schisler and Rod Roseychuk here that actually work directly with the derm patients. But in the intro, you heard that I like infectious diseases. And so we have actually had a great experience studying some things that if you're a pure dermatology interested person, I've picked some things that at least I know you see as part of your life. And one of those would be the potential herpes dermatitis with one of our models there on the right side of your screen. And then our most recent work is looking at whether or not we can make pit bull terriers with juvenile demodicosis, generalized demodicosis, if we can make them get better faster. Obviously, wanted to acknowledge our sponsor of most of my research in this field, Nestle Purina Pet Care folks. And I actually just had the great fortune of getting to tour around a team of the Purina people from St. Louis for the last couple of days. So our work is certainly at the forefront of my mind right now. Now, I think what happens to most of us, and that is my gray talking head there in the Center for Companion Animal Studies picture. I've had the great fortune of being selected to be this Kenneth W. Smith professor, and what I wanted to do, since I had already become a full professor myself, is find ways to give back to the profession, especially with the trainees that I've gotten to work with. Both Dr. Julia Veer on the left side of the picture, as well as Audra Fenimore in the middle. Those guys were both research fellows before they became internal medicine residents with me, and their fellowships had been supported by Nestle Purina. But what we've been doing in the last couple of years, and how it ties into the lecture, is what we've been trying to do is make sure that our clinical specialists have chances to do quality research that then, hopefully by saving 25 dogs with Demodex, for example, if we find something interesting and publish those results, then we can impact even more animals than the ones that we saved in the study. And so I always start all my lectures, those of you that I've met in previous meetings, you've probably seen one of my Young Investigator Awards slides. We basically now gather donation dollars from all these great companies, and then we apply those to grants that are written by our young faculty. But the interesting thing about our program is they actually have to have a student as a scientist. It can't just be a bean counter building the spreadsheets. And in fact, in the competitive process, the students, if they write the grant, or at least part of the grant, they actually get more points. And so I just show you this slide just as another great reminder, just like London Vet Show and BSAVA. These sponsors do so much for us, and industry-sponsored research can turn into really good science as well. So thanks to Nestle Purina in specific today, but also thanks to the industry profession as part of our veterinary team, helping us keep the giant cruise ship of research moving forward. I do believe that we should always give disclosures when we have financial relationships with people. I am not currently a paid consultant from Nestle Purina Pet Care. I don't get a paycheck because of them, but we have had great interactions, as I was sharing with their upper management the last 3 days. They did help us remodel a surgery suite so we can now do 3 tables over at a local humane society. When we were in that American economic downturn in 2008, which I think you guys felt a little bit yourselves, we lost one of our dermatologists. And thankfully, Nestle stepped in to help us fill that gap while the position was frozen because of the budget. Obviously, we do the student grants, and they're a gold sponsor. They helped me remodel my center a few years ago. And they're our only corporate sponsor for a program we called Saving Animals in Shelters by Teaching, which is a way that we can do inexpensive surgery for animals that have been injured in shelters in the local areas. And then the last couple of things, they have been instrumental in helping us train people. I've run a shelter internal medicine fellowship through my center for a number of years. And of the team that's listed there, Dr. Fenimore is now board-certified internist, Dr. Wiggins, board-certified ophthalmologist, Dr. Martin is finishing her PhD, Dr. Winagle just passed the ACVIM boards, and Dr. Contreras is doing a combo PhD shelter residency. And we would not have had any of those positions without their generous support. So with that being said, I also have great opportunities to work with Hills and Royal Canin as well. We are still non-denominational school, so I think I can give you guys a balanced lecture today, but certainly huge thanks for Nestle Purina Pet Care for what they do for the industry, as well as for my center in specific. But with that being said, let's talk about some research. Clarissa is in the lower left there, Dr. Souza, and then Jennifer Schisler is in the lower right, and then Dr. Contreras, the current shelter fellow PhD person holding the beagle in the middle, and Dozer, one of the generalized Demodex dogs, is in the upper right. I did want to acknowledge these guys. I worked with the scientists at the Nestle Purina Pet Care, Emily Cross in specific, who's very interested in dermatology. We all brainstormed how we could perhaps learn more about the immune stimulating effect of probiotics. And that'll be the middle talk that I share with you in a few minutes, which brings it back to Dozer and his Demodex. But I did want to acknowledge the folks that are actually doing the work. I'm one of those guys that helps them get the money, hopefully has some good ideas now and again, but they are actually doing the boots on the ground work with taking care of those particular dogs. And hope then you guys will be seeing Dr. Souza presenting some of this work as she finishes up her dermatology residency. She's a second-year dermatology resident here, and Dr. Schisler is one of our 2 faculty members. So as a means for introduction, probiotics, as we all know now, since that's been a buzzword for quite some time now, are live microorganisms that actually do something good for the body. And gosh, how many years now have they been studying probiotics? It's just crazy. In fact, the Enterococcus faecium strain SF68, the one that's in Nestle Purina's product FortiFlora, that's in many countries around the world, that probiotic was discovered in the 1960s. And so while veterinary medicine, it seems like probiotic use is relatively new, probiotics have actually been studied for quite some time. And so first thing that I like to mention when I kind of launching into a probiotic talk is that we have some pretty standardized definitions now, both in the human medical field and in veterinary medical field, of that what a probiotic should be characterized to be considered beneficial. And you guys know most of those already, so I won't bore you with reading them off. But what the problem that's happening in our side of the pond is there's not quite as much regulation for probiotics and some of our other food additives when it comes to rigorous testing being required before marketing. And in fact, it's really been interesting in North America, and I apologize if I missed a UK study that's very similar, but when researchers in North America purchase probiotics or things that are sold purporting to be probiotics being sold at veterinary conventions and or pet stores, sometimes in the human health food stores, it's pretty crazy what they'll often find. And I'm sure you guys are familiar, if you like probiotics, and Scott Weiss's kind of first hallmark paper on this subject 13 years ago, published in the Canadian Veterinary Journal. In this particular study, the 19 commercial pet foods that were claimed to have probiotics were the ones that were tested. And I went ahead and just put a rectangle around one of the statements that I found to be fascinating, that not only did they not have probiotics sort of met a label claim, but some of them, there was actually no growth. And not just some, 26% of them. And so that's kind of bad if you think about it. And then if you look fast forward to another one of Scott's papers now, 8 years later, hopefully things might have improved in those 8 years here in the United States. In this case, only 4 of the 15 products tested actually had basically met or exceeded their label claim. And it's pretty frightening that could happen. But again, in this particular industry, at least in the United States, the oversight is not as good as it would be, say, for a new antibiotic. And so to me, it's a very key point as you guys go to London Vet Show, or spring over into the spring and go to BSAVA. If there's a multitude of stands showing and data selling probiotics, the first thing I like to have them show me is, what data do you have on the stability? You say that it's good on the shelf, for 2 years or whatever they might claim. I just ask them bluntly, professionally, and nicely, can I actually see that data where you've proven that the shelf life it is what you claim, and that at the beginning of that growth period, those live organisms are still there at the end of the label time point. Now, in the States, we have, again, a little bit more data that I know of on our side, but when you take those 15 to 19 different claims that not very many of them actually met their claims, 2 that kind of really filter out quite frequently on our side has been the Nestle Purina pet care product, the ProPlan Veterinary Diets product, FortiFlora, and that's Enterococcus faecium SS68. And then we have the great company Nutramax, and they're ProViable. It's tended to meet label claim, good quality control, a lot of different organism numbers in there. So bottom line is, when I send vets to the shows here, it's like, well, these 2 we know they have pretty good quality control. And then a nice thing about these 2 companies, and again, I'm not picking them as favorites, I'm just using them because they have good quality control. These 2 companies on my side of the pond also do a relatively large amount of research. Nestle in particular, their life is our laboratory is one of their statements over here, and they're really, really capitalizing on having good science, in my opinion. So that's the other question that I asked the probiotic seller at a veterinary convention, for example, is, 1, how's that quality control? Prove to me you got the shelf life you claim. And then my next question is, what type of veterinary studies have you supported to date to let me know that it actually might do something against the problem that you claim? Not just that it should increase good GI microbiota, but actually, what do you have that actually shows that it does those things? And I'm sure many of you know Marge. She was one of our children in the early days, has been in the UK for quite some time now. Her nice little editorial in Journal of Small Animal Practice just 2 years ago. I thought was a really good one, just making the point that I think that we should all hear is they aren't all the same. And so for an example, say you did a Nutramax study, or in my case, a lot of FortiFlora studies with Nestle Purina Pet Care. Say you did that study, say you were the company that funded it, showed that your probiotic actually did something, and then the client immediately says, oh, cool, probiotics look like they work, and then go buy lactobacillus from the health food store. Well, I tell you, they're not all the same. And so you really do have to align yourself with the products with good quality control that the companies have actually proved that they do something. And sometimes if one company proves that their product does a great deal of support for a clinical condition, you can't just assume that another one would also do the same. And then another thing you've probably been following on our side, Enterococcus faecium SF68, the FortiFlora organism, it's been quite the success, I believe, for the company because it's a really good probiotic. But what's really funny is there are a couple of other companies that have then capitalized on the fact that their probiotic also has Enterococcus faecium. It's not the same strain, but they capitalize on the whole genus and species thing, hoping that you as a consumer might perhaps confuse the fact that it's actually not the one in FortiFlora, but just another Enterococcus faecium that may or may not, that particular strain may or may not have any positive clinical benefits. So it is very important to me to spread the word around the world, is just ask the difficult questions for them. Quality control and what have you done to prove your product works. If they have that data, buy it. Seriously, I don't work for Nestle Purina Pet Care. I work for Colorado State. If somebody shows me good data that their probiotic does something good and they are stable and meet their label claims, I'll obviously consider that for use as well. But right now, Nestle Purina Pet Care has been one of the ones that has been willing to put their money where their research is and has given us a lot of data. And so I'm going to just make a strong statement there, and then we'll move on a little bit, starting to lead into some of the studies that might be of interest to those of you that care about dermatology. The strong statement I'm going to make is, for interest of time, and when you have a speaker that's coming in from outside, I do think that it's wise to focus on the work that that person has done. And so I am going to pretty much talk about studies that used FortiFlora from this point forward. But again, as I acknowledged on the last slide, if you've asked those hard questions and you get good answers, good data, all probiotics that have been proven by somebody to be beneficial and good quality control is fine with me. Okay, well, so before we go into the studies that I've personally done that you might find of interest, I thought you've probably done or have considered doing some of the things that I've had to do recently as I became more and more interested in dermatology and more interested in probiotics and prebiotics, is actually kind of scouring the human literature first, since they do have a long, rich history compared to us. In fact, as you can see in this review article, between 94 and 2015, they actually had 70 studies that they were able to review. And I thought that that was kind of an interesting paper. And by the way, if you would like any of the references that I show today, please ask for them on my email, and I'll be glad to send them over. But this was kind of an interesting one because the strongest link to positive benefit they found in those 70 some odd studies was use in treating kids with atopic dermatitis. And I think that's fascinating. Why it's fascinating? Because since I was kind of a probiotic dummy myself just 10 short years ago, I only thought about the effect that they were probably going to have on good microflora, microbiota in the gut, increasing those lactobacillus organisms, the good things that they're supposed to do. It wasn't actually until just 8 years ago that it finally crossed my thick skull that probiotics might actually have immune modulating effects. And so, again, you probably figured that out before me, but being an honest kind of guy, I never really thought about the immune modulatory effects that some of these probiotics may have. And this nice review paper is a great one. It's kind of a lead into that statement. So then if you look at what's been done then in the canine side of things, there is actually some work. This happens to be a lactobacillus probiotic, but they showed similarly to a meta-analysis from the human side that you might actually be able to lessen clinical signs associated with inflammation with this particular probiotic. So I think these couple of hallmark earlier studies are very intriguing that would make us start thinking that perhaps our derm cases might actually be benefited by substances with immune modulation. So with that being said, though, I think we do have to get more data saying which of that plethora of live organisms known as probiotics that might have a clinical effect. We need to know which of those might actually do something. And so as I started getting more and more interested in the subject, and then companies like Nutramax and Nestle Purina Pet Care were more and more likely to fund studies of this type, it kind of put us all together, and I guess that's why we're here today. So I'm going to spend just about 10 minutes maximum a piece for each of these three studies to make some points that I think might be beneficial to you in your practices. So, as you heard in the introduction, I'm a infectious disease internal medicine guy. My PhD is actually parasitology. If you've ever read any of those papers on toxoplasma, IgM testing, clindamycin for toxoplasma in cats, that was some of my work back in the 80s during the PhD years. Well, since I liked cats as a species, I kind of got sucked over to herpes. Obviously, if you like cats, you're going to end up doing a herpes study somewhere down your career. And this is one that Julia did a few years ago here in a local shelter. And I just wanted to remind you how common feline herpes virus 1 can be, especially if you're in the shelter for 21 to 28 days. It's frequently the exposure rates are in the high 90s. So why that then I felt was important in probiotic world is we do have obviously our little acute kittens, but we also then have chronic diseases due to herpes, the keratitis, eosinophilic sequestra. We have a number of things that can be herpes related. And then how I tied it into you, other than those of you that are interested in dermatology, how I tie it into this lecture is not only just the fact that the conjunctiva is right next to the skin, but also because we now know that herpes does also very readily cause dermatitis of the face and then sometimes on the feet as well. So if you think about some of the great work that's been done, like Dr. Lee's paper over with Jackie in Australia, knowing now that this particular organism does cause dermatitis, it was certainly a great discovery, especially when we find that these cases will have eosinophils when you're doing your cytology. And boy, oh boy, the last thing you wanted to do if you had feline herpes virus causing the illness is give them steroids or cyclosporin because you saw the eosinophils. And in fact, I think that's partially how these cases were discovered, is us doing our classic anti-inflammatory immune modulation, thinking it was a allergic type disease, only to have them have their face fall off when we gave them steroids. So why I wanted to share some of this with you today is, first and foremost, it can be a little bit tough to prove a facial dermatitis or forelimb, a feet type dermatitis due to herpes. It is a little bit tough, especially because Dr. David Maggs did it first, and then our group did it a while ago. And then there's this great paper from our friends in Europe. We can unfortunately find herpes because of DNA in vaccine strains. And as y'all know, at least in the United States, we use a lot of modified live herpes containing vaccines. So a simple swab being positive for herpes may or may not prove disease. So please keep that in mind. The immunohistochemistry of tissue is probably more powerful than a superficial swab for herpes because of that chronic carrier phase, as well as the fact that modified live viruses also colonize the host. So I hope that we've established, and maybe we all agree, that you can have facial dermatitis or dermatitis often on the feet from cleansing their face that could be due to herpes. It can have eosinophils in it, so sometimes got confused with allergic disease. Once you have herpes-associated illness, then obviously there have been a number of things that have been talked about, but I thought we'd first kind of update the oral lysine story. The Boll and Bunnock paper was a very nice review of the literature about lysine, and I was pleased to see that most papers were captured. Now, I don't necessarily agree with the conclusions. If you remember that veterinary research, the BMC veterinary research paper, one of the conclusions was that we just shouldn't use lysine in the cat at all anymore. And that statement I don't agree with. I do believe that it can help keep herpes chronic cats in remission. It's not a very good treatment. I do agree with that. But just like people with cold sores that stay on lysine, it does seem to lessen the recurrence of disease, and when the disease does occur or recur, it's a little less severe. So I will still use it as a practitioner in some situations, but it is a bit of a band-aid. It's not my favorite, as we'll talk here on the next couple of slides. I did want to, on this slide, though, remind you of the two recent North American papers that showed that supplementation with lysine, given a scoop of lysine every day to every cat in the shelter, there's actually been two papers now suggesting that that's not going to be good money spent for the shelter, again, because it did not lessen the prevalence rates of URI or the upper respiratory infections. And, that's probably because there are other things that cause URI in cats in shelters, and lysine only helps with herpes. So again, back to, do I do it as a clinician? Yes, occasionally. Do I do it as a preventative in shelters? The answer is absolutely not. Now, if you have an animal that truly is sick due to herpes, the famciclovir research from Sarah Thomasy and David Maggs and others around the world is really kind of your key anti-herpes drug. So I don't want to imply that a probiotic is going to take the place of famciclovir if you had a keratitis cat or a severe rhinitis or conjunctivitis. But I did want to remind you, as you go back to using this particular drug, is that we started with using like 32.5 milligrams per cat, not per kilogram. Remember the ultra low days when we actually thought it was doing something? Well, now we know that you actually have to get closer to 40 mg per kg to get decent blood levels. And paper just last month from the Davis guys, look at the dose, folks. 90 mg per kg twice daily actually gets you good tear levels. So for those cats that are easier with ocular disease, that are easier to treat orally, you can use famciclovir, but to get good tear levels is much, much higher than we ever used in the old days. Thankfully, Sarah had already written a paper, Sarah Thomasy, showing that 90 mg per kg 3 times daily was safe in cats. But if I do have a sick cat that is ill today, rotting off their face because I gave them steroids and it was herpes or bad keratitis conjunctivitis, it would be famciclovir. But what we wanted to ask then is, what about immune modulating these cases? Again, if they have facial dermatitis due to herpes, could we do anything via the immune system? You guys have been very lucky, many of you, if you're listening or watching from the European side of the pond, then the omegagen, having that feline omega interferon, has allowed a number of studies to be performed. That one we don't have in the United States, and our FDA is making it very expensive for Virbac to get it approved in the United States. So most interferon studies in my country have been human alpha 2B interferons. But I did want to mention both of these in this lecture today because there is a little bit of work. Obviously, the great paper that was published in 2007 that kind of got people thinking about immune modulating. And depending on doses, you might also have a antiviral properties, but definitely we now know that interferons are also immune modulatory agents. And so with that being said, I'll let you guys continue to think about using interferons acutely or chronically, since you do have the omega in your country, but we don't. And so in the States, I was very, very curious about could an immune modulatory or an immune enhancing probiotic actually do anything with herpes. And in fact, when I first met the folks from Lausanne, they asked me, Jaleel, who's one of the co-authors here, Christoph, these guys were showing me some of their puppy data, saying, hey, would you like to do some cat work? And so that veterinary therapeutics paper from a couple of years ago that helped fund Dr. Beer's final year of her PhD, that was the one that we showed over time. We did finally get some separation over time of T lymphocytes, and it was the T helper cells. And so that was our first study. One, we showed it was safe. We showed a few effects on the microbiota. We showed that it didn't persist long-term in the host. But this little blip, that fact that we could show a difference, made me very interested, and thankfully was able to acquire funding, is could you use a probiotic to help you with your chronic recurrent herpes, kitties, knowing that T-help is very important with that particular virus. And so if you don't remember this study, I'd be glad to send it to you. It's getting a little long in the tooth now at 7 years old. But Ebenezer and Gail and Julie and I did get approval to take cats with chronic herpes and perform an experimental study. What our hypothesis was is feeding this immune modulating probiotic, and again, remember, increased T helper cell percentages. At that point, it had also been proven to be immune modulatory in puppies. So basically, we took that initial work and said, okay, well, hey, what if we feed cats with herpes this probiotic versus a placebo? And by the way, guys, all the studies that I'll talk about today, the placebo is the palatability enhancer, which is a hydrolyzed chicken, which is why it tastes so good. So bottom line is we did this study. We took the cats that had chronic herpes, put 6 of them in one room, 6 in the other room. We don't get the probiotic from the company in the sachets. We actually get it in capsules. And one capsule will be blank. The other capsule will have a red dot. And basically then what we do is feed one room the probiotic with their food. The other room gets the placebo. And so in this particular paper, we let them equilibrate in their gang rooms for a period of time, went ahead and started their probiotic, and we wanted to give them plenty of time for it to kick in, since at one time we thought it took several months to get full effect. And then during the time that it was on the probiotic versus the placebo, then we took them, they're in their same rooms, so again, they're in individual rooms. But what we wanted to do is then change their housing. You know, they live together for 28 days. Then they stay in their same room, but then we put them in individual cages. So they can still see each other, but they can't directly interact. And as you guys probably have already figured out, the cats that are living in the gang room, sometimes the little ones are being picked on a little bit by the bigger cats. And then the little ones, actually, once they're in cages, sometimes are actually much more outgoing and much happier than when they're in the group housing. Then, of course, the big ones that like to pick on the little ones, they, I think, are a little bit happier when they're in the group houses. So bottom line is, as you'll see with the results here in a second, that changing of housing from gang to cages was enough to induce some mild stress. I'm not going to bore you with the whole study today, but we did all the classics that you would do to evaluate for potential reactivation of herpes in the face of stress, with the hypothesis that the immune modulatory probiotic would lessen those reactivations. But before I show you that punchline, I did want to show you that Gail, our collaborator in Lausanne, Gail was able to show that this probiotic, and this was actually even before some of our diarrhea work, this probiotic was able to actually kind of improve the diversity in the treatment group. So the decreased microbiota diversity in the placebo group, that's a bad thing. So bottom line is this was one of their first papers in the cat that showed actual positive effect on that microbiota. But here's your punchline on the conjunctivitis scores on these guys. And obviously it's hard to induce herpes dermatitis, and so I can't say that we've been able to study it directly. But during that supplementation stress periods, the cage changes, the dark bars, the FS68 project conjunctivitis scores, whereas the open bars are the placebos. So boy, I tell you now, again, I started saying it several years ago, since I know lysine has to be given as a dose twice a day and doesn't actually taste that great, if I was trying to keep a chronic recurrent herpes cat in a better remission, it's a heck of a lot easier to give an immune modulatory probiotic that actually tastes good because of that hydrolyzed chicken byproduct. And I actually now use this for my chronic recurrent herpes cats even more than lysine. So in summary of that particular work, if you do have a really bad facial dermatitis, please use famciclovir. And if you're using a lower dose than like we used to, please remember blood levels are best at around 40 mg per kg twice a daily, tier levels at 90 mg per kg. And I do believe, because of work that's been performed in Europe, as well as our work with FortiFlora, that immune modulating those cats could potentially be beneficial. So next time we'll try to do another study. We'll do one of these kind of combo things. Hopefully, Nestle Purina or others will be happy to fund that. Okay, so let's build in now to Demodex and do that study for 5 or 6 minutes. So here's that first paper. Jaleel and Christoph were my first friends of the family from the Lausanne side of the world. They came up to me at BSAVA one year and saw one of the cat type papers that we were presenting and said, hey, we've got a probiotic, and it's going to obviously turned out to be FortiFlora. They said, hey, we have this probiotic that seems to be an immune enhancer, or at least an immune modulator. And I got a chance to have a look at this paper in 2002, right before it was published. And if you remember this paper, they showed a number of things over time, and this is weeks. This happens to be total fecal IgA. The supplemented ones are the triangles, so the charts will all be the same. Bottom line is that over time, and it looked like it started separating somewhere between week 18 and week 30, that some kind of non-specific things, which could be potentially beneficial, at least in infectious and immune diseases, total fecal IgA went up. There wasn't a ton happening with serum total IgG, as you can see, but check out the separation of the increase, and this is just total, not specific, total IgA made statistical significance at week 18, which persisted. And then if you remember this paper, they also showed that the supplemented puppies were less likely to have their distemper titers drop. And so that was kind of cool, to have their distemper antibodies stay higher longer. So now, obviously, these other levels that you see here with the placebo, those are still protective. You don't need to use a probiotic to enhance your vaccines necessarily, but it does prove the concept that FortiFlora was immune modulating, perhaps even immune stimulatory in dogs. And so that led then to our normal cat data with the T helper cells, followed by the normal cat herpes. And I've been intrigued by it ever since, because if you can show a lot of B cell things like the increased antibodies and all that. Obviously, you have to have T help. You have to have T help to have B cell turn on. And so while Jalil's work didn't show a lot with the CD4 positives, those would be the T helper cells or the T cytotoxic lymphocytes, the CD8 positives. While they didn't show anything in their flow cytometry, they did show increase in the percentage of B lymphocytes, as well as then, obviously, they were making their antibodies. So I was intrigued, and it's kind of been floating around in the back of my head for quite some time, led to the herpes work. And then recently, we're like, man, maybe we could get a little bit more data. And then the other thing, if we back up to the dates, maybe something happened in here earlier. Maybe something happened here earlier. And so we discussed for a long time, how could we come up with some sort of model where we can have naturally occurring diseases? Because seriously, it's hard to induce chronic herpes. We can't induce Demodex-associated disease almost at all experimentally. And so as we read some of these really great papers by Luis and others, giving good reviews of immunology and pathogenesis of canine demodicosis, as our research teams, start reading and talking, it was like, wow, well, could we use this particular disease syndrome? Could we use that to perhaps, one, help the dogs get better faster, and two, use this disease syndrome to perhaps further prove whether or not probiotics could actually have immune modulatory disease. And so that then leads to what we've been doing here and is ongoing right now is, can we do something in the field of demodicosis? And as you guys know, the seroliner and the other isoxazolines are just been great for Demodex. In fact, gosh, it's just kind of reinvented the field of clinical treatment of the syndrome. And so it's funny, even though Bravecto in our country and some others in Europe is such a great Demodex drug, we didn't actually want to use that particular one in the study that I'm going to share with you next. We actually wanted a little bit slower kill, and I'm not being critical of Advocate or Advantage Multi in my country, but we did choose to study our probiotic supplementation versus placebo supplementation study. Instead of using Bravecto or one of the other orals, we did go ahead and use topical Advocate or, again, Advantage Multi in my country. So again, our purpose, and this is part of Dr. Sousa's master's, our purpose was, multiple fold, but one was to, can we determine why some of these dogs and not others? So our grant covers all the immunological testing in the affected dogs like Dozer to unaffected dogs that come from the same shelters. We chose to study a single breed rather than just doing generalized juvenile demodicosis. We chose to do one breed to try to standardize. So it's been really great. We've been presenting a little bit of the data orally about what we've been able to find. And so here's what we've been doing. We repeated some of Jalil's work with the initial young beagle study, but did some of our testing more frequently rather than 8 weeks apart. We've been comparing findings of pitties with and without generalized juvenile demodicosis. And we are doing a clinical trial where all the pitties get Advocate, the other half all get Advocate, half get the probiotic. And again, we are studying Enterococcus faecium SF68, and the other group is getting the placebo. These are all double-blinded, so we don't know what's in the capsules. The people that are opening the capsules and putting it in their food do not know what they're giving, and those that are doing the skin scrapings and the clinical scoring do not even know which capsule in which room. So it's been pretty easy to keep this one blinded. This one's great because it is a pilot study using shelter animals. And so when those guys have their skin disease normalize, then we can move them on into private homes. So it's another great way to take a natural model, save some more lives, and then hopefully when we're finished with this particular study, hopefully Dr. Sousa will publish it and we'll know whether or not using this probiotic is beneficial for speed of recovery. So again, basic design from many of the different Demodex studies. So I'm going to have to give you a few results verbally today because this webinar will be online, so we can't jeopardize publication. But Clarice has been working very hard. We are having great recoveries to Advocate. Our newest addition is Tulip. As you can see, Tulip's pretty severely affected. We have now shown that FortiFlora kicks in immunologically in normal beagles as soon as 4 weeks. It doesn't take 20 to 28 weeks, so it's actually faster than we thought previously. We have shown some major differences in their T-cell immunity of the affected ones compared to their age-matched controls. We don't know yet whether or not that's induced by the mites or if it's something wrong with these pit bulls. The bottom line is we will have a little bit more information about why some pit bulls perhaps and not others. And it's too early to tell you whether or not the probiotic's having a positive effect. Again, we haven't broken the code, so I can't share that with you, but I am happy that this substance kicks in as an immune modulator earlier than what I thought before. And I just wanted to show you a closing picture for this particular study with Dozer now in his new forever home there in Fort Collins and one of his new best buddies. So stay tuned on that. We'll be showing that at some of the derm meetings as we go along. We hope to have plenty of new data for you for the next year's research abstract cycle. And the last very short study I would share with you today, and then open it up to questions, is we all know that when you have diarrhea, that's suffering. And so to get from that stool, which would be a combination of about a Nestle 5 to 7, to that, which is a nice normal stool, is obviously our goal. Well, how did in the world, Anthony, am I going to tie it into a derm lecture? Well, as far as I can tell, we have some of our dermatologists in North America somewhat addicted to Clavamox, amoxicillin clavulanic acid. And when we were working on this research idea, we kind of polled a number of our colleagues that do dermatology to say, hey, how often do cats prescribed amoxiclav? How often do they get diarrhea? And when we were making the design, we based the design and the power calculation on numbers of cats to include, based on about 40% we thought would have a soft stool. Well, when you see the punchline here in a second, it's actually much higher than that, which we'll talk about in a second. But we do take our research cats that, say, come off a vaccine study, and we rehome them all. No research cat has ever been killed on purpose at the Center for Companion Animal Studies. So what we do, though, sometimes we think about these additive studies. Camille is our new nutrition training program person. And a couple of students and my fellow helped this one happen, Francisco, epidemiologist. Well, here's the design. Why I felt that you guys would care as people that prescribe beta-lactams for our staph problems. We wanted to see, could we, if we used this probiotic and the antibiotic versus the antibiotic plus a placebo, could we lessen it? So since we knew that we could lessen diarrhea in animal shelters, we knew it had some good effects, but no one to our knowledge had ever looked at this probiotic, or honestly in veterinary small animal medicine, no one had ever looked at any probiotic to lessen antibiotic diarrhea. So in this case, we have the cats caged during the time. We went ahead and caged them early so that we could kick out anybody that was predisposed to stress colitis or diarrhea. So we did that in the equilibration period. And then we just pretended like it was an abscess protocol. We did 7 days, and we did the probiotic or the placebo 7 days longer than the antibiotic. So in this particular study, first, we proved that the probiotic is killed by clavamox. So we did give the probiotic first, then 2 hours later the antibiotic, then the second dose of antibiotic later in the day. But here are the numbers, guys. Look at the ones that had diarrhea. 12 of the 14 cats, and a 5 on the Nestle score, as you guys remember. The 5s are pretty diuretic. But we were able to then drop that down to, still had 11 of 13 cats had a score of 5 at least once. But if you look at the cumulative numbers of diarrhea samples in this study period, very strongly, significantly different. In the 7s, which are like water, that only occurred in the placebo group. We did not see that in any of the animals that were supplemented with FortiFlora. So just like in people, probiotics won't totally eliminate antibiotic-associated diarrhea, but this is the first study to our knowledge that was able to show that it might lessen diarrhea, making the owners perhaps a little bit happier while you're treating your skin infection or other antibiotic-responsive diseases to amoxiclav. We'll have the effect on microbiota in this particular paper as well. This one was not directly funded by Nestle Purina, but thankfully we were able to do the work over in our center. So those were the data that I wanted to share with you guys today. I hope that I've convinced you that probiotics, at least the ones that have been studied, and in this case, the Nestle Purina SF68 product, can be immunomodulatory, helping with chronic recurrent herpes, can perhaps help stabilize your microbiota in stress periods or antimicrobial drug-associated diarrhea. And in our early work with the pit bulls, showing that they can immune modulate as early as 4 weeks into treatment, might be interesting in some of these chronic derm type cases. Then further literature from others, people and dogs, looking at allergic dermatitis, I think is going to be a great place for companies that own immune enhancing or immune modulatory probiotics. Will be great places to study in the future. So Anthony, thanks again for letting me be part of this program, and Nestle Purina Pet Care for putting us together. Hopefully you guys could understand my English. I tried to block out the y'alls and boy howdies and all the stuff we said in Oklahoma when I was a kid, and kept it in a way that you could understand. So thank you very much. I'm certainly be happy to take any questions.
Thank you so much. And we will be getting the recording up early next week and obviously get your certificates sorted out. But hopefully we will see you on a webinar very soon. Thanks everyone, and good night.